Yes.
She
May I
has
also
17.
record this for me?
You have 17 questions?
What?
You can have 17 questions. I will start with, I moved your breast MRI to Monday.
Oh, there. Thank you. Wait. Oh, MRI. Yes. Okay.
Yes, on a
Thank you.
Christmas
That's what.
Eve.
That was one of my
Yes.
questions. Never mind.
We were
I'm
like,
good.
A
that's
spot came up. I said, I got someone.
Yes.
Take it.
Yes.
I'll tell her later.
Yeah. Thank you.
we
You
were
don't need to
like,
call her. I'm going to tell her later. Don't worry.
I got the text and I
Yes.
was like, which one is this one for?
Yes.
Yeah.
So-
Thank you.
Yes. I'm like, just take it. So we're going to move that to Monday.
Is that still in International Plaza?
I think so.
Okay.
When you check out, they'll give you the information
Oh,
on where it is.
okay, okay.
We do them here and we do them at International Plaza. It doesn't matter. It's the same radiologist that reads them no matter which place you go to.
Okay.
Okay.
I just want to know where it
The
happened.
MRI will give us additional information that's
Yeah.
important for making decisions and talking about what happens next. So I'm really glad that we're able to do that
Yeah,
on Monday.
me too. Yeah.
yeah, it seems so far out.
It did. It did. Yes. So what's happened is breast MRIs have become more and more recommended as screening for patients. And as such, more patients are getting them. And so we have less availability for our patients with a new diagnosis of cancer who really need them.
Okay.
So I think we're working on trying to get more machines to kind of offload some of that burden. So come sit over here for me
Oh.
and let's chat. Maybe I'll answer some of your questions before you even ask.
Okay.
Okay.
Yeah.
So this is my silly brush drawing. These are lobules. Lobules make milk. And then the ducts carry the milk down to the nipple.
Okay.
Okay. If we cut the duct in half, it's lined with kind of regular, normal looking cells when it's normal.
Oh, that's normal. Okay.
I'm not an artist. Clearly. And then sometimes for some reason, the body can get a signal for these cells to start to divide more rapidly. And as the cells divide more rapidly, they become more and more abnormal until eventually they become cancer cells.
Oh.
When the cancer cells stay inside the duct of the breast, we call that in situ, or DCIS, ductal carcinoma in situ. But cancer likes to grow, and so a lot of times what happens is it comes outside of the duct, and that's invasion or invasive ductal carcinoma, which is kind of a fancy way to say common breast cancer, and that's what your biopsy showed.
Okay.
Okay, invasive ductal carcinoma. So 74% of people that have breast cancer have this type of breast cancer. And so that's here. I'm going to give you a copy of your pathology report so that you have it.
Oh,
But
thank
that's here, invasive ductal carcinoma.
Okay.
Okay. So what happens next? Well, first let me say that is your left breast. So your left breast, we know when they did a biopsy of the mass or the calcifications that they saw in your breast showed breast cancer. And then when they took a sample of the area underneath your arm, that also showed cancer. Okay.
So not in the right though?
On the right breast, when we talk about breast biopsies, I say there's three things it could be. It could be totally benign, normal, not you. It could be cancer, that's what's going on. But sometimes it's something in the middle. So that's here, right?
Is that me? Middle?
That's on the right side.
Oh.
So we call it atypia.
Atypia.
And that's where the cells don't look 100% normal. They don't look like cancer cells, but they don't look normal either. And because we know that your body's figured out how to make breast cancer on the left side, we're going to want to remove the area on the right side.
Yeah.
Okay.
Yep.
And it's not the same surgery that's needed for the cancer, but we do want to remove it.
Okay.
Okay.
The calcification.
So
What remove what?
yes.
Yeah,
So the area that we see. Yes.
Okay.
Okay.
So we're talking like this like tissue and things like that.
Yeah.
So
Okay.
that's the type of breast cancer I have. The
So you have invasive ductal carcinoma.
Oh,
On the
that's
left.
On the left.
right is
Atypia.
something. It's something in the
Yeah,
middle.
something in the middle.
Yeah.
Ah.
Okay.
Okay. So the right, we're not going to talk about again
Okay.
For
during this conversation.
Got it.
okay.
We're going to talk about the cancer part.
Okay.
Okay. We'll revisit this.
Yeah.
Okay.
But
Okay. Good to know.
so 3 ways we remove breast cancer. Okay. The first is with a lumpectomy. And a lumpectomy is where we remove the cancer and leave the breast behind. I'm writing this. You can keep this paper.
Oh,
So you don't
thank
have
you.
to write all
just
this
pay,
down.
just
Okay.
pay attention. I know. She's so.
It's okay. I'm writing all of it down for you.
It's okay. Just pay
Okay.
attention.
Okay.
That way,
Sorry, can you repeat what that
Yeah,
is?
see, that's why. It's
and okay, put this down.
yeah,
Okay.
just for now on.
And then we're going to go over all your questions after I
Yeah.
talk.
Okay.
Yeah.
Okay? Okay. So, number one's a lumpectomy. That's where we remove the cancer and leave the breast behind. Okay?
Okay.
Okay.
Does she still work?
Yes.
Okay.
So you're just removing the cancerous part of
Mm-hmm.
the breast tissue. You don't take everything.
Correct. That's what a
Oh.
lumpectomy is.
Okay.
Okay.
The asterisk to that, right?
Yeah.
The caveat is we need that MRI to make sure there's not more going on in the breast.
Yeah,
Yeah.
yeah. Of course,
Okay.
Yep.
We need to get a full picture.
Yep.
You're young, you have dense breast tissue,
Mhm.
and sometimes mammograms don't tell us everything, and the MRI tells us more of the story.
Yeah.
Okay.
Okay.
So, Dr. Kylick says sometimes when we find a cancer,
It
it's
could
like
change.
finding an animal in a cave.
Yeah.
Right? There's an animal in a cave, and every
You
time
don't know
we
if there's
do a
other
test,
animals.
well, it's like shining a flashlight into the cave so that we get a better idea of what's going on.
Okay.
Okay.
You know, a biopsy is a flashlight.
Yep.
An MRI is a flashlight. A mammogram is a flashlight. An ultrasound is a flashlight. So these are all ways for us to find out more of what's going on before we go in there.
So
right?
after the MRI and PET scan, possibly the one could be like, we can't do one, we have to do two or three.
Sometimes.
Okay.
Sometimes.
Will I know prior
Will you know prior?
to like knowing what I'm gonna get?
So you don't go under anesthesia and you don't know what surgery you're having. When you have the operation, you will know what operation you're going to have prior to the
Okay,
operation.
okay,
Yes,
yeah,
we'll
okay.
talk about it at length beforehand.
Okay.
Okay. So lumpectomy is where we remove the cancer and leave the breast behind.
Okay.
In order for a lumpectomy to be effective,
Mm-hmm.
we have to do two things. We have to remove all the cancer,
Mm-hmm.
including a normal area of tissue around the cancer that we call the margin.
Mm-hmm. Okay.
I think about that like a Tootsie Pop. You need Tootsie and always candy coating around it, right? There always needs to be like a safe zone.
Yeah,
Okay.
yeah, of course, yeah.
And if you have a lumpectomy, we also know that you need radiation therapy.
Yep. Oh.
Radiation's like an X-ray to the breast
Oh.
that you get every day, Monday through Friday for about 6 weeks.
Okay.
Okay.
Oh, wow.
Dr. Kylick says radiation is kind of like a day at the beach. You get sunburned and tired for no reason.
Oh, yeah.
Okay.
Okay.
But it's pretty well
So
tolerated.
it's not chemo.
It's not chemo. We'll talk about chemo in a minute.
Radiation.
Yeah, I've never heard of that.
What? So is that?
It's like
what,
an X-ray.
and it's. Is this like a second after the surgery? It's
It's
like that
after the
extra
surgery.
safeguard to just make sure
Yep.
everything
It's
is.
kind of like an insurance policy.
Like a, yeah.
Yeah, we kind of zap any stray cells that might be left in the breast.
Okay.
How's that gonna affect the area that's been what is it?
Yeah, so
surgically.
it can-
whatever, right?
It's like a sunburn.
So it's gonna make it worse?
It
or-
can.
Okay.
It can just, and it's usually just for the period of time and a little bit after
Okay.
when you have the radiation. But
Okay.
radiation's pretty well tolerated.
Okay.
Okay.
It's probably changed over the years. That's-
Definitely.
Yeah.
And also radiation to the breast is different than radiation to other places in the body.
Okay.
The good part about the breast is it's kind of on the outside of your body.
Okay.
People that have radiation to their lung or to their gut, like there's other stuff there. And
Yeah.
so it's a little bit more toxic.
Ah.
For the breast, it's a little less toxic because it's really on the outside of your body. There's no organs next to it.
Okay.
Okay. So a lumpectomy is an outpatient procedure. You go home the same day.
Oh. Okay.
You come back 2 weeks later.
Uh-huh.
We check on the incision to make sure everything's healed okay.
Okay.
And go over the pathology, you know, exactly what was found at the time of surgery.
What's pathology?
Pathology is what the results are.
Okay.
What the microscope
Sorry.
tells
Okay.
us. Okay, what the microscope
A lot
tells
of big
us.
words.
It's
I don't
okay.
know. Okay.
So, option 2 is a mastectomy.
Wow.
Mastectomy is where we remove the breast and leave you flat.
Okay.
Okay, that's a bigger surgery.
I'm a trans.
It requires a night in the hospital and also a drain to be placed
Oh.
that collects your post-surgical fluid that you have to keep for 2 to 3 weeks after the surgery.
Ooh,
Okay.
okay.
We teach you how to manage that before you go home.
Okay.
Mastectomy is a longer surgery with longer recuperation time and definitely more emotional, you know, for most women too.
Okay.
Okay.
I'm sure you have some questions about how that affects hormones, and maybe
Oh,
that's another
yeah.
conversation. I know I
Shit, I
would,
forgot.
but
Yeah.
yeah.
Yeah. So it doesn't actually affect
it
hormones.
doesn't.
Yeah, it doesn't. Now, we'll talk about hormones later.
Oh,
on.
okay,
That
sorry,
has to do
I'm
with the way
kidding.
that we're going to treat the cancer.
Okay.
And then number 3 is mastectomy with reconstruction. So that's where a surgeon, like Dr. Kylik, removes the breast, and then a plastic surgeon finishes the surgery to remake the breast.
Huh?
Sometimes they do that with a breast implant. Like they put an implant in underneath your skin.
Okay.
Other times they take a flap of tissue from your belly or your back that they move up to make a breast mount. These are bigger surgeries, longer recuperation time. And reconstruction can soften like
Yeah,
the emotional part,
yeah.
but even the best reconstruction in the world isn't the same as what you have now. Okay. As far as overall survival, these options are equal. Where things get a little bit tricky is just knowing how much cancer we need to remove.
Yep.
And that's why the MRI becomes so important.
Yeah.
Okay. Does that make sense?
Yes.
Okay.
What do you know? What stage yet? Without the MRI, still need
So
MRI.
it's at least a stage 2 because we know that the lymph node has cancer. So it's at least a
that's
stage 2.
two.
Okay.
But we don't always know the stage until following surgery because
Oh,
that's when we
following.
know how big the mass is on the microscope and how many lymph nodes have cancer.
Okay.
That's how we determine the stage, how big the cancer is and how many lymph nodes have cancer. Okay.
And the grade as well. You
The
won't.
grade is, so we actually have the
What
grade.
grade?
So
Oh.
the grade is a grade 2,
So
which is in the middle.
In the middle.
Yeah.
So not super
Not
aggressive.
super aggressive.
But not
Yeah, and,
super slow.
and honestly, for most young women, like grade 2 is pretty common.
Mm-hmm.
Okay.
Okay.
All right. So that's. All right. Can I? Well, I'll let
Go
you.
ahead.
I have a question about timeline. I mean, I know. So she went in September to do the initial test. It feels like a long
taking
time.
forever. Yeah.
I mean, what does the timeline look like going forward?
Yeah. So I would say she's going to have surgery within the month now.
In November, or sorry, within
Probably
30
within
days.
the
Probably
month.
early December,
Okay.
if I had to guess. So we
Okay.
need the information from the MRI
Okay.
and we need the information from the PET scan. But once we have that information,
Okay.
things can kind of go quickly.
Okay.
So it feels like forever.
Yeah. Yeah.
Dr. Kylix is like, the cards are already on the table though. Like
Yeah.
it is what it is.
Yep.
This is not this crazy rapidly dividing cancer that's going to spread while we're waiting for you to have surgery.
That's what the last 3 days have been,
Yes.
at least for me. I don't know for you, but for me, I'm like, oh my God, like
Yes.
what?
Okay.
You feel this sense of,
You do. It
yeah,
is.
like in a dark hole that you
It
don't
is-
know.
Yes, it is a super scary place to be in.
Yeah.
However, it didn't get there overnight. This cancer's been there for a little while.
Yeah.
And so we're going to take it out as soon as we can. And it's
Yeah.
more important for us to do this correctly than quickly.
Yeah.
Oh,
Yeah.
okay.
Okay.
That's
Okay.
right. Yeah.
That reassurance
Yeah.
is, that's what we were
Yes.
waiting for.
And this
like-
is a very common, like your situation is very common for you to find something, for it to take a couple weeks to get in, for it to take a couple weeks to have a biopsy,
that's what
to
I
take a
figured,
couple
yeah.
weeks to
Oh.
see the surgeon, to
Okay.
take a couple weeks to
Yep.
have the surgery.
Yep.
It's all a very common
Yeah.
period of time.
Yeah.
It just feels like it lasts forever.
at least, especially.
It's worse for the people that love
Isn't
you.
that- isn't
It
that-
is.
Oh,
Isn't that
It is.
crazy?
sorry. I'm
is.
sorry.
Because you want to do something.
I know, I'm
You can't
like,
do anything.
go
Like,
in
how
there
can I
tomorrow.
do
Why can't they just
something?
go in
What can
tomorrow?
I do to fix this? Because you're a fixer and you can't
Yeah.
fix it. You're like,
Exactly.
somebody else fix her then.
Yeah.
Ex-
Oh, I get
exactly.
it.
Yes.
I, you
yes.
understand.
Yes, I do.
I'm sure I'll understand if I don't have it, but maybe
And-
because I have it, I'm like, okay.
Well,
It's, I don't know.
there's a point where you just do what you're told.
Yeah, that's it.
You're like, okay, tell me what's next.
yeah, yeah, yeah. That's
And you're
it.
like, but what's next?
Yeah.
When can we do that? How soon
Yeah,
can we do
that's
this?
true.
It's basically
Okay,
the way
yeah.
the last 3 days have
Yeah.
been.
Uh-huh.
Yeah.
Yeah, I get that. What else?
Would you happen to know if it's like hormone positive?
It is hormone positive. So let's talk about that.
See, you've been doing your research.
That's a great question. So let's talk about chemotherapy. So when we talk about chemotherapy, there's 6 things that help us make decisions if someone needs chemotherapy or not.
Okay.
And the first is, how big is the cancer?
Okay.
So we start talking about chemotherapy usually if it's between 1 and 2 centimeters.
What's mine?
That's a really good question.
Oh, so you don't know yet until
I
after the
don't.
scans
I
as
need
well.
the MRI.
Ah.
Because in your breast, all we see is this little area of calcifications. I think there's probably more
Yeah.
going on than just those calcifications. So I don't know yet.
Yeah.
Okay.
We
Do
look
I
to
keep
see.
this paper?
Yes.
I'm sorry.
We look to see about the lymph nodes, right? How many lymph nodes have cancer? So we know that
How many lymph nodes do I have?
So you have between 10 and 30
Oh,
lymph
I didn't
nodes.
know that.
In
Oh.
that area?
I thought I only
Underneath
have
the
like
arm.
one.
No, you have
Wow.
between 10 and
I
30
didn't
lymph
know
nodes
that.
underneath
Okay.
the
I
arm.
didn't know that.
We don't know how many you have until
Yeah.
we take them all out.
Oh.
And we're
okay.
probably going to do that at the time of surgery.
Got it.
Remove all of those lymph nodes that are underneath the arm. Mhm.
Okay.
Wow.
The MRI will give us more information
Okay.
about that too.
Okay.
Okay.
Wow.
So we look to see about the lymph nodes. So you get a little frowny face because that leans us more towards needing chemotherapy. Okay. Then we look to see things like estrogen, progesterone receptors, right, or hormone receptors.
Yep.
And yours is hormone receptor positive. And it's actually 90% positive. So it's kind of like a grade in school, the higher the better. And yours is positive, and that's good.
But
That's
so why is
good.
that a good thing?
So it's good because instead of needing chemotherapy, sometimes we can give you a pill to take,
Ah.
like tamoxifen. It's a pill that helps block estrogen to breast
And that's
cancer
the one that's
cells.
gonna put me into menopause.
It doesn't necessarily put you into menopause. It makes you feel
Yeah.
like you're in menopause.
Yeah.
It's not for everybody. Some people fly right through it and do
What?
fine with it.
Okay.
Everybody's a little different. Okay.
Okay.
HER2 is a protein on the outside of cancer cells. When there's a lot of that protein, it's a sign of aggressiveness of a cancer.
So
Yours is negative, and
oh,
that's good.
good.
So that's
Yeah.
one positive
That's
of all
good.
those.
That was my
Absolutely.
next
Yep.
question.
Yeah.
Well, we have a
I
couple
read,
happy
I read
faces
about
here,
that.
yeah.
Yeah. So that's.
We
okay.
also consider your age, right? You're very young. You have lots of life left, or you have lots of decades of life left. And so we're going to be more aggressive in the way that we treat you,
Ah, ha, ha, ha.
less
'Cause I'm
aggressive the way we
better.
treat a 90-year-old,
Yeah,
right? So this
yeah.
is a frowny face for you.
Oh,
Yeah.
great.
And that, well, and that it's always your decision. Okay, so I do think that we're going to revisit this conversation, and I do think that it's very possible that you'll need chemotherapy, but we're going to do surgery.
Okay.
Well, we're going to do the MRI,
Uh-huh.
Yeah.
And then the
And
PET
the PET
scan.
scan.
Yeah.
Mhm.
see exactly what's going on, do surgery,
Okay.
count up all the cells and see what we're working with.
Yep.
After that, you'll have an appointment with a medical oncologist that will help make the decisions on what other sorts of treatments.
Ah,
Okay.
And so you'll have the MRI,
thank you. I was gonna write that
the
down.
PET scan, surgery, medical oncology. Those are the chemo doctors.
Oh, okay.
So it's them that
And
I
then
asked about
radiation
my
doctors.
treatment. So I can't even like discuss really treatment until after the MRI.
Or
is
surgery
done,
is
the
technically
PET
treatment,
scan.
right? It's like the first.
It's one of the
step-
treatments.
First
Yeah.
step in
Yep.
the treatment.
So I feel like this is kind of what's going to happen next, right? The
Okay.
MRI, the PET
Yep.
scan, probably surgery.
Mhm.
Sometimes, depending on what we see here
Yeah.
between the MRI and the PET scan, sometimes we do surgery first, and sometimes we end up doing chemo first.
Oh,
Those
so
are
you can do-
interchangeable.
oh.
So if it needs to shrink
If
before
it
you
needs
go
to
away.
shrink before we
you
go, so
in.
we need a little.
Oh.
The MRI will help us make those decisions.
Oh.
Okay, but those two things,
What do
surgery
you mean
or
if it needs
chemo,
to shrink?
are interchangeable. So sometimes it's an easier surgery
Oh.
if we can shrink
Oh.
down the masses.
Oh, okay.
And sometimes we know that you need chemotherapy.
Yeah.
Like if we look in there and there's a lot more cancer than we expected, we know for sure that you're going to need chemotherapy. And so sometimes it's helpful. Let's just get the chemotherapy out of the way first,
Oh.
right? We shrink those cancer cells, and hopefully when you have surgery, there's nothing left.
Oh.
And so I think that these things will give us more information to figure out what those steps need to be. But
Okay.
sometimes those are interchangeable if we know for sure that you need chemo.
Oh.
So, again, this is just my
That's okay.
being on Google and all nervous wreck. But I've read. I mean, obviously that puts you in a different stage. But I've also read it. It's also its function is to collect.
Correct.
So it's working the way it's supposed to, but at the same time, you don't want it
Yes.
to start moving outside the breast tissue. It's this weird
Yes.
positive negative. type
Yes. And
thing.
so lymph nodes, they kind of help direct fluid in your
Yeah.
body. And when
Yeah.
we remove lymph nodes, it can increase your risk of having swelling in
Yeah.
your arm, right? So it's called lymphedema,
Oh.
arm swelling. So if we remove all of the lymph nodes, it can increase your risk of developing arm swelling at some point in your lifetime. It's about a
Yeah.
20 to 30% risk. So it's not a certainty at all.
Okay.
However, our first priority in this room is going to be the same. We have to take care of the cancer
Yeah.
first.
Yep.
And whatever happens next, we kind of just have to deal with it. right?
Yeah.
And so I don't want you to have arm swelling, right?
But
But I
that's
want
one
you to
of the
live a
risks.
long
It's-
time.
yes,
That's one of the risks and side effects.
It's one of the risks. It's not a side effect
Oh, sorry.
because it's not something that is certainly going to
Yeah.
happen,
Yeah.
but it is a risk of developing arm swelling later in your life. And that's something that's annoying but not life-threatening.
Yeah. When you weigh the, yeah.
Okay.
Okay?
Yeah.
Let's see.
What does that mean? Risk? Like, no, I mean, like, what the arm swelling? I'm
It,
gonna have to
it
Google
means
that.
it means
Lymph-
it's possible.
It's just
Lymphedema.
possible.
It
You
means
can-
that it's a possibility to happen.
And I'm sure there's ways to treat that, right?
There are,
Yeah.
and-
Oh,
Yeah.
okay.
Okay.
Well, yeah, you answered most of my question. What are my treatment options? And right now you cannot recommend any treatment because without the scans.
Yeah, so I mean, we
We have
kind of know what the next steps are going
Yeah.
to be, right?
Yeah.
MRI 1st.
Mhm.
Let's see how much of the chest is affected. Let's see about the lymph nodes. Let's see about the breast. The PET scan will show us everything from head to toe. Make sure we're not missing anything anywhere else in the
Yeah.
body too. And then we'll know what the next steps are as far as surgery goes. You know, it's hard to even say what surgery options make the most sense for
Yeah.
you without having a whole picture.
Yeah.
And I think that the PET scan and the MRI are going to give us a little bit more of that picture.
Yeah,
But
'cause my
surgery is
dad
almost
died of-
certain of some
Surgery's
sort.
certain.
Yeah, that's
Yes.
certain.
My dad died of colon cancer, so it's the PET scan that can look at everything.
Mhm.
Yeah, that'd be good to like get everything and know
Mhm.
everything. Yeah, that was my next question. My the risks and side effects of treatment
Mhm.
and
Yeah.
yeah,
And I think
there's a lot.
well,
Too much.
Well,
to,
today's a big conversation about
yeah.
a lot of things.
Yeah.
Yeah.
And then once we have more information, it's a little bit at a time. Okay, we
Okay.
have the MRI. What does that tell us?
oh, okay.
Okay, we have the PET scan. What does that tell us? What's the next steps? Okay, I need surgery. This is the surgery that's recommended.
Yeah.
What does that look like? What does that recovery look like? What do I expect from that surgery?
How long does it take to read both MRI and PET scan?
Oh, the next day.
Oh wow!
And
they're
Dr.
good.
Kylik is very, very good about calling you right away.
Wow.
Okay.
So he will have those discussions by the phone. You don't need to come in for those conversations. We can have those conversations on the phone about what the recommendations are based on what we see in those tests.
Okay, that's good to know. Yeah, it makes me feel a lot better. Things are gonna happen next week with these. Yeah.
Me too.
The
Okay.
thing is like they're gonna call me and
Yeah,
you're gonna have
everything-
questions and I'm not gonna.
everything-
You're not gonna. Be
No,
there 'cause
I
you're
know
gonna be
when
at
it.
work.
This is the background, and then you can
Yeah.
fill me in on the details.
Everything, I feel like everything, it was frustrating for me too because I wanted it to happen faster for you.
Yeah.
But I'm glad that things are moving now.
Okay.
Like
But-
as soon as I got results, I'm like, okay, now we can do something.
Well, part of me is like when they scheduled for December, and then you called and talked. I think there was another
Yeah.
nurse. I was like, okay, well, it can't be super aggressive.
Right.
They wouldn't have allowed
Yeah.
it to be scheduled
And it-
that far out.
And it's not that it's more aggressive. I just
think-
also want, like you,
Sooner
this has
rather
been
than
going
later.
on too long. Like, let's go.
Yeah.
Like, it's time, let's go.
Yeah.
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 And I know that we're waiting for these to answer some of our questions.
Yeah.
So sometimes it's a little clearer
Yeah.
and sometimes it's not. We're still shining flashlights.
Mm-hmm.
Yeah,
Okay.
that makes sense. She answered all my questions. I'm sure the
Yeah, I
doctor
can't answer the
will-
questions until after pretty much the
Yeah.
scans because
Yeah.
it's like my other questions like how will treatment affect like my daily life, quality of
Yeah.
life, but we don't even know what.
That's
treatment
kinda down the
is.
road.
Yeah.
It's just the big thing is just get it out of you
Yeah.
first, right? That's the
Yeah.
number one priority.
Mm-hmm.
Take care of the cancer.
Mhm.
Right. Okay. Well, I'm going to talk to Dr. Kylik. He'll come in and talk to you some more. I'm going to leave you with my picture.
Yeah,
I'm
that's,
going to leave you with your pathology report as well so
And-
that you have a copy of that.
and he's going to go over that in more detail.
Yeah, I mean, well, it's
or-
kind of the same thing that we talked about.
same thing.
So this, on the right side, we'll talk about that again.
Oh, okay.
We usually just do something that's kind of like a lumpectomy. Where we
Okay.
just remove
Oh,
that
so I
area.
do get the
On the
something
right
done on the right
side,
side
yes.
too. Okay.
So that surgery needs to happen as
Yeah.
well.
Oh, okay.
But not as urgent as.
Yeah, but if you're going to go
But
under
you're still gonna
anesthesia.
do
Oh, you would
the
do
same
it all
thing,
at the
right?
same
Yeah.
time.
I'm like, why would you wait?
Oh, I
I'm
didn't
gonna
know.
go twice.
I
Just
didn't
take them all.
Yes,
Yeah.
exactly.
Okay.
So we'll address both of those things.
Okay.
We're not going to forget about the right side, but the left side takes the
The
priority.
priority.
I got
Yeah.
it.
Okay.
Okay.
All right, my dear.
Thank you
Dr.
for the
Kylik
drawings.
will be in next, okay?
Okay.
Okay. And then you'll meet Jane. She's the nurse that works with us. She'll give you more information about whatever is going to happen next.
Okay.
Too, okay?
Thank
Thank
you.
you.
That's very cool. I got notes.
So some positive news. you're HER2 negative and you're 90% hormone receptive. So,
Whatever that means.
but I think this is what's probably going to drive. These two are going to drive probably you having to do some sort of chemo.
Well,
I'm
actually,
just
my
guessing.
age, I have I'm not. Technically, being more aggressive is kind of a good thing because that means like they can hurry it up.
Well, it's not. She didn't say it's not aggressive. It's kind of like
No, they can be more aggressive in the treatment.
Oh, okay.
So it technically.
Oh, because you're younger. Yeah.
Yes,
Yeah.
because I'm more in a state of recovering faster.
Yeah, but also
than an older person.
she also made it as if.
The only thing
You
is
have-
it's aggressive because I might have a lot of like mental.
But they weigh okay 80, 90-year-old.
Yeah.
Okay, they might not be as healthy
Yeah.
and receptive, but also
Yes.
they don't have as much life left.
Yeah,
so they
that's
kind of
true.
like weigh they might be like quality of life, and the risk of the chemo might not outweigh you living just a couple more years. Where you, it's like you just need to clear everything out
Yes.
to
yes.
maximize.
Yeah, so they can do.
'cause you have-
they
yeah.
can do pretty.
Yeah.
They have all of the tools.
Yeah.
Yeah, that's true. Yeah.
I have to do. I was reading about this HER2 and estrogen
Yeah,
receptors.
I know about her.
So HER2 is a
but
good.
I'm
It's a
not
good
sure.
thing that you're not, because it just means I think it's not as aggressive, or it just means that it won't multiply as fast.
Oh,
it takes a
okay.
longer time to multiply,
Yeah.
which is why you've probably had it for a while and it really hasn't
Yeah.
gone.
It's probably been there for like.
Well, it takes years for it
No,
to.
yeah, like years. Like I probably had it even when I met you, and it's just been.
It may have just started, or
Yeah,
like,
it just
well,
may have
they said like
started.
maybe you can ask that to the doctor and be like, when did this start? Like, how do I even know
Oh,
when it?
I
That would be
guess
because he
so,
could answer
yeah.
those types of questions. Oh God, this sounds.